Carol said, I'm Patton. I'm the Vice President for Nursing Operations for Catholic Health Initiatives. Catholic Health Initiatives is a 105 hospital system located in 19 states across the country. And we had a total of $15 billion in revenue last year. And I tell you that because we have a very diverse system. If you've been reading and keeping up with modern healthcare over the last year, you know that merger and acquisitions are in full swing across the United States. Not just with our system, but with many other systems across the U.S. And so we have been hot and heavy with mergers and acquisitions. And in doing so, we get lots of technology that is either brought into our system or that people are joining our system in order to adopt that technology that we have with us. So we have 4 EMRs that we use across our system, Cerner, Epic, Allscripts, and Meditech. And then we use 3 different types of pumps. We have a couple different RTLSs. We have a couple of different voice command systems that we use. And so in doing that, there's a lot of technology. So I'm going to talk to you a little bit today about how to drive a technology with nurses. As we know, in most of our institutions, nurses derive about 60% of our workforce. And so getting them on board is critical and crucial. But you can't forget the other clinicians and the other staff there as well, because they're going to help you drive adoption. So it all starts with leadership. So I always tell people when I go into a system, especially when I'm doing operational aspects across the United States, is that it begins with leadership. If you don't have a solid leadership in place and they're supporting the technology you're wishing to get them to adopt, you're not going to have success. It's plain and simple. You can't just have the CEO of the system or the hospital just nod their head. You can't have the CNO and CMO says, yeah, that sounds like a great thing. You can't have the CFO just say, yes, I spent $1 million on that product. You have to have true adoption and have true leadership that's going to do that. I really like the U.S. Air Force's definition of leadership. And I'm going to read it to you just because I think it's really profound when you hear it. Leadership is the art of influencing and directing people in such a way that will win their obedience, confidence, respect, and loyal cooperation in achieving common objectives. And that's all what we're out for, right? When we're talking about adoption for technology is really doing that. I really like that definition. So how many of you have seen Robert's adoption curve, diffusion of innovation? So a lot of you have. This really is key. And a lot of people, if you don't understand this, you're going to fail in your organization. And we had lots of bumps in the road as we tried to adopt technology. I'm really called the theory geek at CHI, and I love theory and love how it adopts to different types of aspects. And so this Rogers theory of diffusion of innovation really talks about that. If you know that you're going to have a small amount of people that are going to be either technology enthusiasts or visionaries, you'll know that those people are going to jump on board first, right? We all have those in our organizations. People who love technology, they want the next best thing. We heard some speakers talk a little earlier, right, about the nurses who are coming on board and they're wanting the technology first. So you have to know that those are just a small amount of people. And if you know that and understand that, you're not going to get upset, you're not going to get frustrated, and you're going to know that they're going to be the people who are going to blaze the way for you. You then have the chasm in the middle, and then you have your pragmatists, right? Your pragmatists are those people who are the wait-and-seers. The people who are going to say, are they going to do it? Is it going to succeed? Are we going to have IT glitches? Is it really going to work with the technology we have? Is there going to be Wi-Fi problems across our organization? Once you bring them on board, you have half the battle won, and then you know you have the conservatists and the skeptics. But let's talk just for a minute about that chasm that there's in the middle. If you don't solidify that chasm, if you don't build that bridge to help those people get from the visionaries over to the pragmatists, you're pretty much going to have an uphill battle the rest of the way. Lots of times we have luck, and lots of times there'll be people who will just adopt it across the organization because they feel like it. But if you're one of those organizations, I would love to talk to you after this speech so I can understand how you did it. Most of us don't have that, right? Most of us have those people that we have to struggle to get them to adopt technology. Otherwise, why do we continue to measure? And we have that measurement. We have 70% adoption. We have 80% adoption. We have 90% adoption. So building that bridge over that chasm is really key. And it really comes to about during leadership and how we envision that along the way. And so I'm going to talk to you about a few ways and how you build that bridge. What are some key aspects that you can take away today that will help you build the bridge over that chasm? First of all, you have to meet the nurses where they are. How many people have you seen people like this in your organizations where you walk around and the nurses are just tired? They're at their edge. They're worked their 12, 13, 14, 15-hour day, and they're just upset. If you don't meet them where they are and understand what they're going through, it's really hard to build adoption of technology. It doesn't matter what technology it is. It doesn't matter whether it's your EMR, your new pumps that you're bringing on board, your new SCDs, whatever it is. If you don't meet them where they are and understand what each unit is going through, you're going to have a hard time building that bridge, okay? So ORs are different than EDs, are different than med-surg units, are different than radiology departments. So go to the unit, find out what's going on, find out where they are, and meet them where they are to help build that bridge for that chasm. Next, ask them what they want. Find out what they want in technology. What are they looking for? What are they going to be interested in doing as they go forward with this new technology you're adopting? So for example, if you're looking at an EMR, did you go out and survey them and survey the staff to say, do they want in-room computers? Do they want them outside the computers? Do they want computers on wheels so that they can do that? Did you really ask them what they wanted versus assuming that everybody needs a computer in the room because you want them to chart at the bedside? Can they chart at the bedside with using carts on wheels? Sure they can. Do nurses want to push carts around all day? Probably not. So ask them what they want, how they want it. When you're instituting different pump technology, we're doing that right now in North Dakota and South Dakota and Minnesota. We're asking the nurses, what is it that you really want in your pump library? What's important to you as you move forward? How is it that's going to make a difference for you? How can we make it easier for you to do that? So asking them what they want in order to build that bridge more effectively. Next is shared governance. How many of you have shared governance in your institutions or know what that is? Not many of you. Shared governance is a way we call it different. Shared governance, shared leadership, same things. What we call that is how we bring not only nurses but staff together to really govern themselves. And what that means is you put staff nurses in a room, talk to them, build a charter on how they're going to do things going forward, and then have them decide how things are going. So when you're getting ready to implement a new technology, bring a group of nurses, nursing assistants, secretaries on the floor together, talk to them and say, here's what our plan is. We would like to develop or implement this new smart pump technology. What is the best way to do it for you? What's the best way to do it for your floor? How do we engage you in a different way so that it has the highest amount of adoption? Let them get into it. What you'll find is that lots of times when they get to do those things, they will get into arguments with each other. They'll get into discussions with each other. They'll get into developing things and implementing things in ways that you probably never would have thought before. But you allow them to do it themselves in order to do that. We have really two great examples at CHI that we use shared governance in really an effective way. Our first examples in CHI Health, and that's all of Nebraska and southwestern Iowa, and they have what they call practice area councils. And in the practice area councils, they meet on a monthly basis. It's led somebody by the divisional staff, and it's staff nurses from each of the hospitals around CHI Health, which we have about 15 hospitals in Nebraska right now. And they meet together on a regular basis to talk about different things, policies, procedures, and different items. Well, they just went through an Epic implementation about a couple years ago, and the practice area councils really talked about how they would then implement it and implement it effectively. So the ED has a practice area council, critical care has a practice area council, respiratory has a practice area council. And so when they talked, they said, how is it going to best affect us? Those leaders that went back to their organizations talked about that and said, here's how we're going to do it across CHI Health for our area specifically, and really had great adoption and great success in doing that. Another example we have is at CHI St. Vincent in Little Rock, Arkansas, where they have a different model of shared governance called Congress. And in their congressional model, they bring together people who are of like mind and a representative from each unit to do that. The other key thing that they bring into their congressional model is a union representative. And a union representative sits at the table and has those discussions. And so it's no surprise when you're going out to bring technology to the unit. The union has already been on board. They've been engaged. They've been talked with about what's going on, and they've been helping make the decisions on A, the technology that's going to be implemented, as well as the process it's going to take to get it implemented. So that's been very successful for us in doing that and involving the unions right at the beginning so that adoption is better well taken care of. And then you also want to talk about what's in it for them. So as we know, the millennial generation that's coming aboard, we're finding this more and more with CHI, that as the millennials come on board, it's really what's in it for them. We're finding that they want to work less hours, they want to have tighter schedules, they want to have set schedules, they don't want to work weekends, and they expect technology when they walk through the door. They want a phone. They don't want pagers anymore. If you give a millennial a pager, they look at you like you have 3 heads, right? So they're like, what is this and how do I use this? So they want the up-to-date technology and what to do that. But you've got to think through it. Before you start to implement technology, think about what's in it for them. Now, with nurses, we have a unique way to say, if we can twist it to say what's in it for them, but what's in it for their patients, you have much better success. Because most nurses, not all nurses, but most nurses are really there for the patient and to do that. So if you can drive the reason that you're implementing this technology for the patient, you will have much better success. And so lots of times when we've gone in and implemented pump technology, some of our leaders have said, this is what we're doing, here's what we're going to do, it's going to decrease our incident reports, and so you're going to use this. Or can you go in and say, here's a new smart pump technology. This is going to save your patient's life because you're going to input the data in here and it's going to tell you whether you've made an error or not, and it's going to allow the right medication to go to the right patient at the right time. And so if you can twist it and tell our nurses what's in it for them and what's in it for our patients, you'll have much better success for adoption. And then I want to talk to you a little bit about transformational leadership. We have lots of leaders at CHI who are transactional and not transformational. And we at CHI are trying to help our leaders become more transformational. And so what does that mean? Well, if you look at the house model, so this model was built in cooperation with the University of Washington Foster School of Business. And so if any of you have looked at or studied transformational leadership, you know that Bruce Avolio, Bernard Bass are big names in transformational leadership. We're very lucky to be working with Bruce Avolio on a full-time basis to really help us build a transformational leadership model across CHI. And so you know that if you have a solid base to your leadership model with moral behavior, so they've got to be moral, they're a balanced processor so that they have really things balanced between what they're doing and how they're doing it. Are they spending enough time with staff? Are they spending enough time in doing transactions? Because transactions can't go away. You still have to have transactions, like you still got to develop a schedule, you still got to sign off time cards, you still have to make sure that things are running smoothly. But you really have to be balanced in that and not always in your office. You have to be transparent. So if you're transparent as a leader in talking about what things are doing, how things are going, where we're going with adoption, they'll be more likely to be on board with you. And then finally, you have to be self-aware. So let's say that you're starting to build that bridge we talked about over the chasm, and things aren't going so well. Are you self-aware that maybe you need to step back, think a minute, talk to the staff, figure out maybe what's not going so right, and then start building the bridge again so you can have a solid bridge. So that's our foundation for transformational leadership. You then have the 4 walls around intellectual stimulation, inspirational motivation, idealized influence, and individualized consideration. Not going to go into the details with you today, but those are things that you have to build, and I can give you some resources and some references if you want to know more later. And then after you have the base built, your 4 walls built, then you have the strategic leadership roof that you can really sit down and think and have your leaders help think about what is so important about building this model. Why do we have to go forward and do that? Why is adoption of this technology important to do that? Now you can also see that the plumbing of the house is very important, right? You still have to have those transactional utilities in what you're doing around how you're doing to adopt technology in that space. So now what? Now what are you going to do? You need to take some of these back and ask your leadership at your organizations, do we have shared governance? And if so, how are we doing that? Can I come talk to them? Can I come present to them before we even implement this technology to do that? Do we even know what transformational leadership is at our organization? And if so, how are we trying to make our leaders more effective? If you're that person at your organization who's responsible for implementing technology, are you going to the staff and asking them what they want? Are you meeting them where they are? Instead of pulling them together in an auditorium or a classroom, are you going on to the nursing unit and finding out what they want and meeting them where they are? So, with all of those things being said, I tried to help you build a little bit of bridge over that chasm in order to get there and how you're going to adopt technology in a little better way for your nurses. So I want to thank you very much for your time and appreciate your attention.